Katie, welcome in today.
Good to see you.
Good to see you too. How are you doing today?
I'm very good. Yeah.
Okay, that's really good to hear. Like you already know, my name is Dr. C, and I'm going to be taking a look at you today. I'm first going to go ahead and ask you to confirm your first name and your date of birth.
Sure, it's Katie. My birthday is March 23rd, 1987.
Okay, perfect. And what brings you in today, Katie?
I am just wanting a head-to-toe exam. I've been experiencing some fatigue.
Okay.
So I'm really glad that you had me laying down.
Absolutely.
And just when I exercise, sometimes I feel lethargic.
Okay.
I just want to make sure that my vitals are okay and that just I'm healthy overall.
Okay, that definitely makes sense. When you're talking about the fatigue, how would you describe it in terms of intensity on a scale of 1 to 10?
I would say at its worst, it's at about a 7, and it happens mostly in the afternoon.
Is it random, or does it happen when you're a little hungry?
It seems pretty consistent. It could be hunger or like the caffeine wearing off. I don't know. I'm not sure.
Do you take caffeine in the morning?
I do. I have about 2 cups of coffee in the morning.
Alrighty. That sounds good, Miss Katie. I'm going to go ahead and set this chart aside, and we're going to go ahead and conduct a full head-to-toe exam today.
Okay.
I'm going to ask you to go ahead and relax.
All right.
I'm going to go ahead and put some gloves on.
Thank you.
Alrighty. First, I'm going to go ahead and take your, listen to your heartbeat. I'm going to go ahead and press the stethoscope to your chest. It's going to be a little bit cold to the touch. Okay. Can switch sides here. Okay, now I'm going to go ahead and listen to the lungs. Go ahead and take a deep breath in and then out. Okay, and then a deep breath in and then out. Okay. One more deep breath in and then out. Okay, great. Your heartbeat is sounding strong and normal. I'm going to go ahead and do a blood pressure test. I'm going to ask you to momentarily rest your little arm. Your blood pressure is 120/80, which just gonna go ahead and slide this on. Alrighty, Katie, I'm gonna go ahead and do some head palpitations. I'm just feeling along the sides of the skull, making sure there's no unusual masses or lumps hiding beneath the surface of the skin. Just going really slowly and gently. Feeling the lymph nodes, making sure there's no unusual swelling. That could indicate an infection or an abscess of some kind. Does it hurt when I pull on your ears at all? Any pain on this side?
No.
Any pain in the temples?
No.
How about on this side?
No pain.
Any pain along the jawbone? Open your mouth all the way. No, close. Any pain?
No.
Any migraines that have been bothering you at all?
No, I usually don't get migraines.
Okay. Do you have a history of headaches?
No, so far so good on that front.
Okay. You can just take a look at the scalp. You turn your nose towards me. Farther. Turn your head away from me. Your scalp is looking nice and healthy. Have you been dealing with any itchiness or flaking lately?
Sometimes it itches.
Have you noticed any dandruff or anything like that lately?
No.
Go ahead and take a look inside your ears. I don't see any discharge or draining. No abnormal colors, just a healthy shade of pink. No excessive wax. Okay, everything is looking healthy, same as on the other side. No signs of any excess dripping, no excessive wetness or discoloration or swelling. Okay, I'm going to have you keep your eyes closed. I'm going to conduct a little bit of a hearing test. You're going to let me know whether you hear this noise on your left side or your right side.
Okay. Right. Left. Right. Right. Left. 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 Both. Left. Left.
Okay, we had a little bit of difficulty with that one. I'll go ahead and make a note of that in your chart. I'm just going to do a sensations test on the ear now. I want you to let me know if you feel this on your right ear or your left ear.
Okay. Right. Left. Left. Right. Right. Left. Left. Right. Left. Right.
Great. I'm going to definitely make a note to come back to that area. For now, we're just going to go ahead and move on. I want you to let me know if you hear this on your right side, your left side, or both sides.
Left. 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 Both. 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 Right. 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 Left.
I'm going to move on to looking inside your nose. Go ahead and just turn your chin towards me a little bit. Perfect. Okay, nasal passages look open and healthy. Have you noticed any runny nose? Any issues?
No, every once in a while, like in the spring, because of the change of seasons, but nothing like crazy.
Okay.
Yeah.
I'm going to go ahead and have you close your eyes. You're going to inhale and let me know what this scent is. Okay? On the count of 3. 1, 2, 3. Inhale.
It smells like chlorine.
Interesting. That was mint. But you
Okay.
were kind of in the right field. One more. On the count of 3. 1, 2, 3.
That smells like metallic, like copper.
That one's orange, so again, kind of in the same world. Okay. I'm gonna have you turn towards me, stick out your tongue and say ah.
Ah,
Okay, wonderful. Everything's looking healthy, bright and colorful. Have you experienced any issues with your sense of taste?
no, I taste things pretty well.
Okay. Go ahead. That's the test.
Okay.
And just stick out your tongue. I'm going to put a little droplet in there on the count of 3. 1, 2, 3.
Cherries.
Good. One more. 1, 2, 3.
Cinnamon.
Yes. Good job. I'm going to go ahead and look into your eyes. I want you to tilt your head towards me. Just 1 second. Okay. Pupils look healthy. They got round and reacted to light. Okay. How many fingers am I holding up?
2, 4, 3, 1, 3, 5, 1, 2, 3, 4, 5, 1, 5, 4, 3, 2, 1.
Good job.
Killed it.
I want you to let me know which fingers are moving on your left or your right.
Left, right, both, left, left, right, both, left, right, both, left, right, both.
Now we're going to do a little bit of a memory test. What is 2 plus 3?
Beats me. No, 5.
Okay. What color is an apple?
Red,
What color is a sunset?
orange, and yellow.
Mm-hmm. What color is a rubber ducky?
Yellow.
What color is grass?
Depends on the state of the grass, but usually green.
What color is the ocean?
Blue.
What color is lavender?
Purple.
How many different colored lights are at an intersection?
3.
Okay. What is the shape of the stop sign?
A hexagon.
What is the sound a cat makes?
Meow.
What is the sound a pig makes? Yeah,
Oink.
exactly. How many toes does a cat have?
6 or 7.
What is a horse's foot called?
A hoot. A hoof.
How many leaves are on a 4-leaf clover?
1, 2, 3, 4.
Okay. Now, I'm going to touch a part of your face. You're going to let me know where you feel it. up, left, right, or down.
Okay. Up, left, down, up, right, left, up, down, nose, up, left, down, right, up.
Now I'm going to have you pull your hand up, cover your left eye, extend your right hand.
Okay.
What is this letter?
E.
What is this row starting from the left and moving towards the right?
D, H, J, B, S.
What is this letter?
T,
What is this letter?
A,
What is this letter?
E,
What is this letter?
E,
What is this row starting at the right and moving to the left?
S, B, J, H, D,
What is this row starting from the left and moving to the right?
L, T, F, P, H,
What's this color?
red,
What's this color?
green,
Ready and switch. What is this number?
95,
What is this number?
874,
What is this number?
9,
What's this number?
2.
Alright, now go ahead and flop your eye in your hand. What's this number?
4,
What's this number?
2,
This number?
6,
And this one.
8,
Now turn the page over. What color is this?
green,
What color is this?
red,
What letter is this?
E,
What letter is this?
E,
Go ahead and read this row from the right to the left.
E, 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 E.
That's, I heard you the first time.
F,
And what letter is this?
O,
Oh, wow, okay. Well, I'm definitely going to be making some notes of how it got worse throughout the course of the exam. I'm going to test your shoulder mobility.
okay,
Go ahead and raise this arm all the way above your head. Okay, and bring it back down. Go ahead and bend the elbow. Now go ahead and I'm going to move down and perform a brief abdominal exam.
okay.
Alright, so I'm gonna roll this down a tiny bit. Does this hurt?
No,
Does this hurt?
no,
Does this hurt?
no.
Now close your eyes. Tell me what shape this is.
Circle, square, triangle, a star, clover star,
Yeah.
face.
Good. I'm going to use my stethoscope and take a listen to the tum-tum.
Mm-hmm.
Things sounding healthy, regular, digestive noises. Go ahead and help to soothe the tummy a little bit with some water globe rolling. Now, we're going to be doing a little bit of wet or dry. This is going to be dry. This is going to be wet. Do you notice the difference between those two?
Yes. Dry. Dry. Wet. Wet. Dry. Dry. Wet. Wet. Dry. 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 Wet. Wet. Dry. Dry. Wet. Wet. Dry. Dry. Wet. Wet. Dry.
Use this to massage the wet oils into the tummy. Right, I'm going to be moving just a bit farther down to look at the light.
Okay.
Go ahead and lift this foot up a tiny, tiny bit. Lift this leg up a tiny, tiny bit. Okay. Had any problems with your feet?
No, they just get really cold sometimes. Like right now it feels good because you're touching them. And your hands are warm.
You had a lot of sock layers happening over here. Okay, I'm going to ask you to raise this leg just a bit and drop it. And raise it again and drop it. And go ahead and rotate the ankle. Little crackety action. Yep. And Go ahead and raise this leg up in the air. Back down. One more time. Back down. Go ahead and rotate the ankle. And reverse. Okay, perfect. The faint cracking of the ankle, that is something that is normal, but I do just want to go ahead and make sure that both feet are pretty equal in size. So I'm just going to go ahead and measure them. Does this hurt at all?
No.
Does it hurt when I apply some pressure?
No, that's really good.
I know you mentioned your feet. They're a little bit cold, so I just want to go ahead and take some samples.
Okay.
It's going to be between the toes and over the nails of the foot. I'm gonna ask you to spread your feet on this toe. Yep, and relax. And this toe. Perfect. And relax. Alrighty, Katie. That concludes our head-to-toe exam for today. The only thing that really raised my concerns a little bit was you mentioned your feet being cold. We'll go ahead and run some tests with the samples that we gathered.
Okay.
And then your hearing and the sensations were a little bit off. So I'm gonna go ahead. Don't worry, it wasn't enough to be majorly concerning. We're just gonna go ahead and follow up with that as well as with the eye exam. So nothing to worry about there. We're just gonna ask to see you in about a week or so.
I didn't hear anything you just said.
You're gonna come back in a week.
Okay, thank you.
You're welcome.
Great.
I am gonna see you soon.
See you soon.
Thank you so much for coming in today.
Anytime. Bye.
Bye-bye.